Hello, ready to master pharmacology? Let's dive into the video. So, what is epilepsy? It is a group of CNS disorder and it is characterized by paroxysmal cerebral dysarrhythmia. Okay, so what is that? Between two episodes of seizure, the patient remain completely normal. Okay, and there is loss of consciousness and it is also characterized by with or without characteristic body movements, which is the convulsions. Okay, so we have the paroxysmal cerebral dysarrhythmia, loss of consciousness, and convulsions. So these episodes are unpredictable and their frequency is highly variable. Okay. Now we'll see about the types of seizure. There are two types of seizure: generalized seizure and partial seizure. Okay. In generalized seizure, we have generalized tonic-clonic seizure, which is most common, absence seizure, tonic seizure, myoclonic seizure, infantile spasm. Now, we don't have to go briefly into this. We'll see about in the medicine classes, okay? Then we have the partial seizure. In partial seizure, there is simple partial seizure, complete partial seizure, and combined of both, okay? So now we'll see about the classification of antiepileptics. First we have barbiturate and then deoxybarbiturate, hydantoin, immunostilbin, succinamide, aliphatic carboxylic acid, benzodiazepines, phenyltryazine, cyclic GABA analogs, and then we have some newer drugs. Okay, in barbiturates we have phenobarbital, deoxybarbiturate we have pyripinol, hydantoin we have phenytoin and fosphenytoin, immunostilbin we have carbamazepine, oxcarbamazepine, eslicarbamazepine. In succinamide we have ethosuccinamide, aliphatic carboxylic acid we have valproic acid and D-valproix. Benzodiazepines we know clonazepam, diazepam, lorazepam, clobazepam. It always ends with zepam. And phenyltryazine we have lamotrigine. Cyclic GABA analogs we have gabapentin and pregabalin. Newer drugs we have topiramate, levetiracetam, zonisamide, vigabatrin, tigabayne, lacosamide. Okay. Now we'll see the mechanism of action of each drug in a detailed manner. All will be represented with this particular picture. You can easily go through it. First mechanism is a prolongation of sodium channel. Next is a facilitation of GABA mediated chloride channel opening. Next is the inhibition of T-type calcium channel. Okay. So normally what happens is that in neurons the sodium channel remains open. Okay, they generate action potential, then channel closes leading to the inactivations. So this generates a stimulus. Okay, so what happens during seizure? During seizure the neurons depolarize, which means the opening of the sodium channels in the neurons. Okay, so this causes firing of action potentials, which means the sodium release at high frequencies leading to the seizure. So what are the drugs acting by this mechanism? First is the phenytoin, carbamazepine, valproate, lamotrigine, topiramate, zonisamide and lacosamide. Okay. Next is the facilitation of GABA mediated chloride channel opening. Okay. So what happens here? We know that GABA is a inhibitory neurotransmitter and glutamate is a excitatory neurotransmitter. So in brain there is balance between these two receptors. Okay, when there is imbalance it causes seizure. So during seizure there is reduction of GABA and there is increased activity of the glutamate, which means there is reduction in inhibitory synaptic activity and there is enhancement of excitatory activities. Okay, normally GABA binds to the GABA receptor and it increases the flow of chloride channel into the cell. So this causes hyperpolarization of the neurons. Okay, and then this causes inhibition of the activity. During seizure what happens? GABA is reduced, so GABA receptor activation is also reduced, so there is decreased flow of chloride ions into the cells leading to the depolarization. There is no hyperpolarization and it causes depolarization of neurons, which causes excitation and leading to the seizure. So what are the drugs acting by this mechanism? barbiturate, benzodiazepine. Here something you have to know about benzodiazepine and barbiturates. Benzodiazepine causes increased frequency of chloride into the neurons, okay, and barbiturate causes increased flow of chloride ions into the cell. Next is valproate and vigabatrin. So this also facilitate GABA, but they have different mechanisms. So we'll see what is that. They inhibit the GABA transaminase. So GABA transaminase is an enzyme which degrades GABA. Okay, so they inhibit this enzyme. So the concentration of GABA in the synaptic terminal is increased. Now we'll see mechanism of action of tiagabine. Okay, this inhibits the uptake of GABA into the neurons. So normally the GABA left in the synaptic cleft will be reuptake by the neurons by the enzyme GAT1. Okay, now tiagabine inhibits this GAT1 enzyme. So concentration of GABA will be increased in the synaptic clefts, which leads to the inhibition. Okay. Next is the inhibition of T-type calcium channels. So these channels are responsible for low threshold calcium spikes. So when there is low threshold, it will help the neurons to reach the threshold for firing action potentials. So what happens when there is firing of action potentials? It leads to the seizures. So inhibiting this T-type calcium channels helps in improving the seizures. Okay. So what are the drugs acting by this mechanism? Ethosuxinamide, valproate and zonisamide. Okay. So that's it about the mechanism of action of all drug. Now we'll just brush up the phenytoin. So phenytoin binds to the sodium channel. The sodium channel is in three state: resting state, activated state and inactivated state. So the effect of sodium channel on phenytoin, it delays the recovery from the inactivated state. So there is reduced neuronal excitability and prevents the seizure. And in high concentration, it also inhibits the calcium reflex into the neurons. So there is reduced calcium entering the neurons. And third is the increased GABA response, which causes hyperpolarization of the neurons, and there is reduced neuronal firing. And then the reduction of glutamate. So glutamate is an excitatory neurotransmitter, so reduced excitation will cause reduced seizure. Next is the adverse reaction at therapeutic level. It causes gum hypertrophy, hirsutism, coarsening of the facial features, hypersensitive reaction, megaloblastic anemia, osteomalacia, hyperglycemia, and fetal hydantoin syndrome. This is very important, so you must not give in pregnancy. It is teratogenic. Okay, so next we'll see at the high doses. Okay, at higher doses it causes cerebellar and vestibular manifestation. So there is ataxia, vertigo, diplopia, nystagmus. Neurological manifestation, it causes drowsiness, behavioral changes, mental confusion, etc. And GI symptoms, you have epigastric pain, nausea, vomiting. Okay, and in intravenous risks we have thrombosis, edema, discoloration of the limb and tissue necrosis. And cardiovascular risk, we have fallen BP, arrhythmias, etc. Okay, that's it for the class. Thank you so much for watching. Follow me for more such videos.